So I want to talk a little bit about breasts, specifically breast volume and what's the trend that I see. I've been doing this for over 20 years and I've seen a trend, and that is that sort of that ideal breast size used to be in that C plus D range. And I would say now it's more that B plus C minus C range. So that's saying that the ideal breast that women are sort of going after today is smaller than what it was even a few years ago. And I'm witnessing this change by how much tissue patients want with a breast reduction, the implant sizes that they're wanting. Rather than 300-400 cc's, we might be doing 150 or 200 cc breast implants. Also, women coming in who have existing breast implants and wanting to go smaller with their implant. Women who just want their implant out altogether and maybe they need a lift to get things rounder, higher, and more appropriate again. So I think the trend is more that healthy, natural, athletic body shape that is going to maybe call for a smaller breast than what we used to see. You know, my tagline, no one will know, everyone will notice, it kind of goes along with that natural breast. If the breast is too small, it can throw the body off where the bottom looks bigger than the top. But we don't have to go overboard anymore and put in breast implants that are just too big for her body. In fact, women are wanting more that B plus C minus size now. And so that's requiring smaller breast implants. You know, if you look at beautiful models and clothes that they can wear, they're largely smaller breasted, and it's just easier to either go without a bra or just wear a bralette or a bikini and not feel self-conscious or imbalanced or overweight. And so whether women are coming in to get their large breast implants out to go smaller, or they're just off the bat requesting a smaller size for their ultimate breast augmentation, I see all of it and I love the trend. How else do we make breasts smaller, or where else do I see that in my practice? Well, you know, when the trend was larger breasts, women were naturally getting larger breast implants in. And as that trend has changed, as her body changes, to go smaller, if you have a breast implant in, we can take that breast implant out altogether. Chances are that patient has more of her own breast tissue than she realizes. And we can lift it with a breast lift and kind of fill in any abnormalities from where that breast implant was, and just lift her breast. And now she's natural, she's smaller, and she feels wonderful and doesn't have to worry about a breast implant. So patients who are on the trend with larger implants, you know, putting larger breast implants in a while ago, they might not want their implant out completely. They just might want to get that B plus C minus cup size by downsizing their implant, because not every patient has enough tissue to just remove the implant altogether. So we can go from a 500 or 400 cc implant down to 200, 150, and give her a whole different look. We may still need to tighten the breast tissue around that smaller implant, and the plastic surgeon does have work to do inside the pocket, but it's a beautiful result. It's keeping with the trend, and I love that liberating freedom it gives women to feel natural, love their bodies again, and wear and do whatever they want. So if I see a patient who's like an A cup or an A minus or a B minus, and she just wants to be a little bit larger, maybe a half cup size larger, and she really is just not excited about having a breast implant, what are her options? Well, we can do fat grafting. We can actually take fat from one part of her body and prepare it very nicely and then move it into the breast. And we can strategically place it wherever we want. So if she's sort of lacking some volume up high or in the cleavage area, we can focus there. If she has breast asymmetry, we can put a little bit more fat in one side than the other side. We can even do a lift with the fat grafting. But what women need to know is that, you know, fat grafting is such a great option for women who just want a small augmentation, maybe a half cup size, maybe a full cup size. No guarantee that you can get bigger than a full cup size, and have it be her own tissue where she does not need a breast implant. It's a wonderful solution to keep that natural, long-lasting result. So, with the trend of smaller breasts, the other thing that we're doing almost every day are breast reductions. So, like I said, there's sort of that ideal size. It used to be in the CD range. Now I would say it's more in the B, C range. So if you're a double D, a triple D, a G, a H, if you have large breasts, a beautiful way to get smaller is with a breast reduction. You basically get a breast lift from that operation. You have less tissue, less discomfort. You even can minimize your risk of getting breast cancer by having a breast reduction. It is a wonderful solution for that natural result. It's all your own tissue. The recovery is easy. And like I said, the trend is that B plus C cup size range, which is just so beautiful.